Joshua Youngs with Medicare Peace of Mind. In this video, I'm going to go over when you want to enroll in the different types of coverages, what are called election periods, or time frames in which you can enroll into coverages without any underwriting, in essence. And so the underwriting is gone. What's underwriting process, if you're not familiar with what that is in essence where the insurance company has an opportunity to ask you questions, perhaps about your health conditions, things like that. And then apply underwriting or assess a risk, potentially decline you, potentially rate your premium up. In the old days, they would put riders on your policy, excluding specific conditions and covering specific conditions. You have diabetes, we'll cover you, but we won't cover your diabetes as an example. So that stuff doesn't happen with Medicare coverages because there are what are called election periods. And so I'm not going to go over when to enroll, so to speak. And so the first one that's most confusing to most people is called the IEP, which stands for Initial Election Period. So IEP equals the Initial Election Period. And during this time, this IEP time, you have this window of time. And so there's what's called a 7-month window. You have 3 green months, blue month, and 3 what I call red months. So use a hypothetical example. We're going to assume someone's turning 65 in July. So July 15th is their birthday. We'll say this person is July 15th, 1956. So a person who's turning 65 in July of 2021 was born in July of 1956. And so in essence, what we have is a 3 months prior, the month of, and so this is going to be July. We have June here, May, and then beautiful April. We also have the 3 months after. We have August, September, and October. So we have this 7-month window in which you have to operate. And so during the 7-month window, if you enroll in these 3 months prior, that means your effective date will start on the first of the month you turn 65. The only exception to that is if somebody was born on July 1st, 1956, there's what's called the first of the month birthday rule exception. And this entire effective date process would be moved up to the 1st of June for the effective date. That would be what's called first preceding month for the first of the month birthday effective date. So if you're the first of the month for your birthday, if you sign up on time, and on time would be in the 3 months before, then your effective date will take place June 1st. And so this IEP window, if you were to wait, as an example, until the 3 months after you turn 65 or the month of, if you wait till here to here, it's going to push your effective date back. When you enroll determines how far it pushes it back. So it pushes it back 1 month here, 1 month here, 2 months here, and 3 months here. What that means is if you enroll in July for your Part A and Part B, your effective date will end up being August 1. If you enroll in August, it'll go to September 1. If you go to September, it'll push it out to November 1. And if you go to October, it'll go November, December, technically January 1 for your effective date. So enrolling on time is very critical when it comes to your Medicare, original Medicare Part A and Part B. And you are enrolling in that during your initial coverage period. So that would apply to Part A, Part B, and you also have your IEP for your Part C and potentially your Part D as well. And so you have all 4 phases following the 7-month window. If you elect for either a C or a D, you're doing one or the other, not both, except for some rare circumstances where you have a private fee-for-service, PFFS plan, or an MSA plan if there's one available in your area as well. That could be paired with a standalone drug card where you, in essence, would have a C and D together. But so this window of time is critically important for you to make sure that you sign up when you're supposed to. You don't want to miss this window entirely. You miss this window entirely and you wait until November 1st to sign up. They would say, sorry, too bad. You're going to have to wait for what's called the general enrollment period. The general enrollment period or GEP is a 3-month window that starts Jan 1 and ends on March 31st. And so January 1st to March 31st is a general enrollment period. During that time, you can either add A and or B. If you need both, you can do both. Or if you only have A, you can add B. If you only have B, you can try to add A. Check out my other videos for finding out what you need to have to qualify for A and B as well. With the GEP, if you enroll anytime in this window, whether it's on January 1st or on March 31st, the effective date you're going to be given for the coverage that you're adding will be July 1st of that year. So if in this example, if you were to enroll before the end of March 31st, 2021, your effective date would be July 1st, 2021 in that scenario, or whatever year you're in, that's how that's going to work. So the GEP is for those that missed their IEP window for one reason or another. So we have gone over IEP and the GEP. There's also something called the ICEP, or the initial coverage election period. What this is for is if you're enrolling into B, and let's say your Part A effective date was, we'll use the same person example, if they are June 1st or July 1st for their Part A, then an ICEP would be if your Part B has a gap of 3 or more months. So your Part B, if there's a gap of greater than 3 months, so 4 or more months. So if this was November 1st for Part B, that would be a situation we're using an ICEP. ICEP would be enrolling into an MAPD or an MA only plan if you're enrolling right at your turning 65 point. But in essence, it's to enroll into an MAPD. What's critically important and different is on the IEP, we had the 3 months before, the month of, and the 3 months after, in which you can enroll any time in that, and you'll get an effective date with your coverage. With the ICEP, it's very critical. This is the effective date again, we're doing of November 1st. November 1st effective date's here. You need to enroll in this 3 months prior. So either in October, September, or August, you need to get the application in prior to the effective date of this one. You do not have the 3 months after. If you wait till November 1st or later, you could potentially be waiting till either the IEP, hope in this situation, be right in the middle of the annual enrollment period as well. You could easily fix it. But we simply modify this to something like June 1st for the effective date, and that modifies all these. So you probably won't have a way to fix it if you miss your ICEP window. So it's a 3 month window. It's the 3 months preceding the effective date of your B. So it's very important to understand this. Also, if you're adding A after the fact, in other words, after your IEP, after that 7 month window, if you're adding A, they will backdate your A by up to 6 months. If you're only 4 months past your date, they only backdate it 4 months. But if you go 9 months working past 65 and don't add A or B because you have an HSA account and you can't fund your HSA account while you're on Medicare, when you do add A, they are going to backdate your A by 6 months, which means you need to stop funding your HSA for that 6 month preceding period so that you don't overfund your HSA and have a penalty with the IRS. And so the ICEP is when you have a gap between your A and B, or if you're enrolling into a MA only when you're turning 65 in your IEP. And so we have IEP, ICEP, the GEP, and then we have another acronym. The government loves these acronyms. We have AEP, which comes around every year. It stands for the Annual Enrollment Period. Over the years, they've changed the name of this a few times, back and forth from, oops, I did my O first. They've changed it from OEP to AEP, back to AEP, back to OEP, back to, it's been AEP for a couple of years now. And we do have another one called OEP, which I'll go over as well. But our AEP is our annual enrollment period that goes from December 7th, Pearl Harbor Day, it goes to December 7th. It goes from October 15th to Pearl Harbor Day, December 7th. So that is our annual enrollment period, ends on December 7th. What's unique about this enrollment period? As an example, with your IEP, you have one election with the IEP. With the ICEP, you have one election. With the AEP, it's the only multiple election period. And so what you do is you have an opportunity to submit, in essence, as many applications as you want or need to. Last application in, December 7th at midnight, is the one that sticks with a January 1st effective date. So with that effective date of January 1st, you have a gap of time between December 8th at 12:01 and January 1st at midnight. Some folks in the past I've tried to help have made what they would call a bad decision on or before December 7th. They've gotten paperwork, they've gotten an ID card, they've gotten all kinds of stuff somewhere between the 8th and the 31st of December. You have until this coverage goes in force to withdraw your application, but you cannot elect a different option. You would have to revert back to whatever option you were on prior to the enrollment during the annual enrollment period. So this is an opportunity for Part A, not A, this is an opportunity for C and D, or. So during this time, you can make a change with Part C. If you have a Part C or Medicare Advantage plan, you can also change your prescription drug coverage during this time. If you have a standalone drug card, this is in essence your one shot for the year to make this change, make an adjustment to this coverage. I highly recommend, if you don't already, if you're on a Medicare Supplement plus a standalone drug card, to have this evaluated for you every year. Most states have 20 plus, if not more, standalone drug card options to look at. And so your prescription list will change over time, and the drug lists that are covered by each plan are changing over time. And then what drugs are on what formulary tier. So tier 1, tier 2, tier 3, tier 4, tier 5. Higher the tier, higher the cost. And so it's really important to double check your Part D card or drug coverage, whether it's on your C built in the MAPD or whether you're doing a standalone D, that is potential for one of your highest out-of-pocket costs is with your prescription drugs. And so it's very important to have this evaluated every fall during the annual enrollment period to lock in your January 1st effective date with the correct coverage that fits you the right way. And so during this time, again, you can literally, on October 15th, you could submit an application to Anthem. And then on October 31st on Halloween, someone knocks on your door and you like their trick or treat, and you decide, well, I like what they're talking about. Even though they're not supposed to knock on your door, it happens. You might move to United Healthcare and do an application for United Healthcare. After that, on November 12th, you might talk to somebody on the phone about Aetna's plan, and you might do an application for Aetna. Whatever the last application is on December 7th at midnight, when the clock strikes midnight, in essence on December 8th, that plan that you're on at that time, last application in, if it's this one, boom, it sticks there. But you did a new application right here at this time, it would be this application that stuck for your January 1st effective date. So the annual enrollment period is a very important time. A lot of folks get overwhelmed with the phone calls and the commercials. It feels relentless. You see famous people on TV all the time from your younger years, so to speak, that are telling you that you can get everything in the world for free and all this other stuff. In essence, that's the time of year where you want to have someone that you can trust that can help you look at your options. Now, where I come from, trusting someone in a call center is more difficult than trusting someone local that you can go talk to, knock on their door, see them face to face. So I really encourage you to utilize a resource local to you, whether it's one of us, the Medicare Peace of Mind's team. There's a lot of other quality agents out there as well. But find one that you can trust. That's my biggest piece of advice. This is a critical time of year for you to make critical decisions that you could be locked into for the entirety of this next year. And so if you pick wrong, you could end up in a bad situation that you cannot get out of. There are also other situations that you can get out of. And so it's one of those things, you want to find somebody you can trust so that you can get that evaluated every fall. And when you do get it evaluated, then you can have that peace of mind of knowing that I'm on the right thing every year. And so we have IEP, ICEP, we have the GEP, we have the AEP. So again, initial enrollment period, initial coverage enrollment period, the annual enrollment period, and then we're going to move on to the OEP, which is the open enrollment period. During this time, it really only applies to Part C or Medicare Advantage or Medicare Advantage with prescription drug plans. So Part C, Medicare Advantage, this is an enrollment period. Yesteryear, it used to be called the Medicare Advantage disenrollment period. They've kind of revamped some of the rules and they've updated the name to open enrollment period. What this is, the spirit of this enrollment period is to give you an opportunity to reevaluate. What happens a lot of times is you lock in your final answer for the AEP by December 7th, and then, lo and behold, January 10th or something, you get a letter, it could be December 10th, you get a letter from your doctor's office saying, oh, by the way, starting next year, we're no longer in network with company blank, and that's the company that you happen to be on. This would give you an opportunity if you're on an MA or MAPD, and your doctor changes or your prescription list changes and you have a new medication your doctor's prescribed to you that is not on the formulary of the plan you're on, there are ways that you can reevaluate. So what you do is it's from January 1st to March 31st. So it's the same time window as the GEP. It's just operating different. GEPs for A and B, so Part A and Part B. The OEP is for C, MA, and MAPD. So it's C only. But January 1st to March 31st, you can make a change. At whatever month you make a change, next month, first of the month, effective date. So you have January to March 31st, January 1st, March 31st. You enroll in January, it'll be a February 1st effective date. You enroll in February. This is a one-time election. It's not a multiple election. So if you use the OEP in January, you do not get another OEP in February or March. You've used it for the one time for that year. So you have one opportunity if you need to make one change, and you have to go from C to C or C back to A and B plus a D. Now, knowing that if you go this route, you also would probably want to add a Medicare Supplement. However, except for certain circumstances, Medicare supplements are underwritten outside of guarantee issue period, whether that's the initial enrollment period or whether that's a guarantee issue period that's triggered from loss of coverage, a move, other things like that. And so the key with this process, if you're doing C back to A and B and a D, to in essence go back to a drug card, this would be underwritten unless you have a guarantee issue period. And so if you're wondering if you have one, I would recommend reaching out to your local expert to ask them, based on my situation, do I qualify for a guarantee issue period? Do I qualify for a special enrollment period? Any of that kind of stuff, because it's really important for you to know what your choices are and what your options are and how it works. And so again, this is a Medicare Advantage only opportunity from January 1st to March 31st. Again, first of the month effective dates, always with Medicare. It's from C to C. That could be from MA to MAPD, from MAPD to MAPD, from MAPD back to MA. Whatever that one-way switch is between a C to C or C back to D, that's the election period you use on your application when you're working with your agent. It's called the OEP, or Open Enrollment Period. That's what gives you an ability to change plans. Once you hit April 1st, you are in essence, for the most part, for most people, locked in for the rest of that year. And so once you hit April 1st, whatever your C or D is for most folks, that is what you will be with for the rest of that year, unless you happen to qualify for an SEP, which stands for Special Enrollment Period. So a special enrollment period. There are a whole bunch of these. The most common ones would be low income. That could either be a dual eligible with Medicare and Medicaid, or it could be someone with an LIS eligibility, which is the Low Income Subsidy Program. Or anyone, any other level of Medicaid. It could be an SLMB, it could be a QI. There's a handful of different eligibility levels for Medicaid, and any of those would qualify for an SEP of some type. There's one for maintaining status, and there's one for change in status. So if you newly get Medicaid, you become eligible, there's a special enrollment period that allows you to reevaluate all your options. Now, this special enrollment period that I'm referring to applies to C and D plans, not to A and B. So the special enrollment period, this particular one would be the 2-month window in which, so we have the maintaining, or we could have status change, not new, because you could be getting it new or you could be losing it newly. So they can, your status can change monthly if your income or resources were to change monthly. Those are the two variables for Medicaid. But in this, you have maintaining, which you can use one time per quarter. So January through March 31st, you can use one time. April through June, one time. July through August or September, one time, and then October through the end of the year. So you can, the last quarter you cannot use it. So once a quarter for the first 3 quarters of the year. That fourth quarter, you'd have to use AEP, and it wouldn't take effect for January 1st. However, anytime you use it in this first 3 quarters, if you use it in the month you're in, it will be effective date of the next month. So if you want to use your SEP maintaining status, you can use that once a quarter. How the change in status one works is once the change in status happens, you get your letter notifying you of Medicaid, you get your letter notifying you've lost Medicaid or LIS, etc. That triggers a 60-day period, 2 months that you have to enroll into another plan, again, C or D with a change in status. So that's one SEP. You could have low income. You can also have a change in residence. That's probably the second most common one I run into. What this means is, and this is again specifically applying to C or D, if you are to change your permanent residence and in the new area that you change your plan to, there are either one of two things. There's either new options available to you, or the plan you have is no longer available. In this scenario, either of these, it would qualify for a special election period. It's the same window as that, 63 days in essence. That's 63 days too. In essence, it accounts for 3 months. 63-day window for the change in residence. Once you either notify the plan you're on, or you make the move, whatever happens first, basically. If you wait too long to notify your plan, you can have your plan just canceled out from under you, and you'll have missed the window of 63 days. And so it's very critical. If you're going to change residence, notify your agent, your broker, so that they can notify the insurance carrier for you. And in certain instances, you'll need to change your plan when you change counties. It's also important if you work with a broker to recontact that broker to do that. There are times where you call into an insurance carrier and their insurance carrier captive internal sales team on the phone will change your plan, and that can get rid of your broker in the process. And then it's much more difficult to help you as a client if you don't have someone that's your official broker of record. And so if you're going to make this change in residence, always, always, always call your broker. Even if you're changing states, don't just assume they're either not in that other state you're moving to. Like me, for example, I'm licensed in 20-something states, and I'll add pretty much any state for the most part, within a few exceptions. For anybody that moves or whatever I get a new opportunity from someone that needs help somewhere else, I will get licensed wherever I need to. So check with your broker. They might do that. Or there's a handful of states that I don't want to go into because of how much regulatory issues there are in getting your license in those states, or weird rules, stuff like that. There are experts that I have connections to in other states like that I can help you get connected with somebody in the new area where you get the same kind of treatment, this annual review process, all that kind of stuff that you come to expect. So change in residence is another most common one. There's a handful of other ones that are a lot less common. If you have a unique situation that you want to evaluate, let us know. We'd be happy to go over that with you and see if you're eligible or not. But these special enrollment periods are usually shorter periods of time. They are also one-time elections. So once you make your one election and it goes into force, the effective date shows up, you're then kind of locked into that decision. So the last one that I want to go over is the Medicare Supplement. It's the initial, I gotta learn how to spell sometimes. Initial enrollment period. Or no, it's the open enrollment period, excuse me. Initial open enrollment coverage period. During this time for MedSups, you are given a different window. And of course, it can't match up to the A, B, C, and D window, which again, if you didn't remember, 3 months before, the month of, 3 months after. How the MedSup window works is it's a 6-month window. Starts with one of two things. It's either your 65th birth month or Part B effective date. Whichever of those happens later triggers this window. And so it's the month of plus 5 more months for a total of 6 months. This does overlap with the Medicare Advantage months because we would have the 3 months before, month of, and the 3 months after. So they would overlap for these 3 months, the first 3 months. And theoretically, if you waited too long, you could enroll in a MedSup still, but you could not get your drug coverage in place as well. So the sooner the better on both these windows. In essence, you want to be making both decisions. If you're in your IEP turning 65 or getting Medicare New, whether you're retiring or whatever the reason is you're getting Medicare New, you want to enroll in these 3 months before pretty much every scenario available. There are a few situations where I would advise against that. However, most people would want to enroll in these 3 months before so that everything starts on this Part B effective date and matches up. It's also critically important on an Advantage plan, MAPD, Part C, or MA only. You have what's called your trial rate. If your Part A, your Part B, and your Part C effective dates all match, which is critical that they all match if you enroll on time during this window. If you waited and you pushed your effective dates back for A or B, or you had a gap, it would create an issue where you would not have a trial right unless you go MedSup first. So you have two scenarios to initiate a trial right. When it comes to trial right, what I mean by that is you can try out under a trial right a Medicare Advantage plan, either for the first time of being on Medicare, again, if A, B, and C all match on the effective date, or in the event that you roll into a MedSup first, when you turn 65, whatever, if you're on a MedSup first, then try out an Advantage plan for the first time. It can't be, I tried one 10 years ago and I'm going to try one again. This is the first time you've ever tried an Advantage plan. Anytime in that first 12 months of being on the Advantage plan, you can exercise your trial right and go back to a MedSup with no underwriting. That's that first 12 months of being on an Advantage plan. Some carriers will extend that trial right out, but it doesn't go to every month. If it goes past the 12 months, it would then be up to another one of these election periods I've covered that you'd have to use for your drug coverage. But again, this applies to Medicare supplements, the Plan G, Plan N, Plan M, Plan A, any of the plans available. There's 13 of them. Any of those plans, during this window, you are taken without any underwriting. Now, in most states, if you are a tobacco user, that is not considered a health condition, and so they can hold that against you, and you will get charged a higher price, even when you're in your initial enrollment period or guarantee issue period for MedSup. They still will take tobacco use into play. So that is what I would call when to enroll in Medicare, top to bottom, all of the different election periods in one video. Hopefully you learned something today. If not, I apologize. I wasted your time, but I would wager that you did learn at least one thing. I do appreciate your time. I hope you give us a call. We have a lot of great brokers, probably one in your area, that would be happy to sit down with you and help you go over all of this stuff or anything that goes on with your coverage. We try to be a one-stop shop for you as far as information, education, counsel, and advice, giving you a biased opinion with a bias is towards you. And so thank you for your time and watching this video, and we hope to talk to you very soon. Thank you. Have a great day.